Hi, I'm Dr. Robin Warren Barnett,
And I'm Don Doudna.
and we are proud to introduce our book we co-authored, Bulletproof, the man's midlife guide to staying strong, healthy, and happy. We wrote this book to address the topics that men often don't want to talk about in their 40s, 50s, and beyond. Things like declining testosterone, heart disease, flabby abs, and changes in your relationship and sex life.
This book is a wonderful guide to everything you need to know about your emotional, physical, and mental changes going on. We've collected many stories. It's a powerful book. It's direct, it's raw, and it's going to have the power to change your life.
I had written a book on women's health called Women, It's Your Turn back in 2002. And a lot of my women said, I love this book. Can you write something for my husband?
And there were a dozen or more books for women as they were going through changes in their life. There was absolutely nothing for men. Why is there nothing written for men as they have significant changes as they start aging? What I'm excited about is that as I talked to men over the last decade, many of them were struggling, but they didn't have anybody to talk to. And so the whole idea of this book, it is a very specific, easy to read, direct communication about here's what people go through, here's what you're going through, and here's what you can do differently. The other thing I'm excited by is that you can start at the last chapter or the first chapter or start in the middle. You can only read one chapter and you will benefit from that chapter. So many other things are written about health read like a medical textbook. This is fun. You get to read a story. You get a very specific list of here's how to do something more effectively, how to do something better.
One of my patients said to me, when I want to build a deck, I go to the hardware store, I find a book, here's how to build a deck, and I take it home. Why can't you write a book like that on my health where I can just walk in, pull it off the shelf, read it quickly, it's fun, it's easy to understand.
I also like the fact that it is very direct, and Robin likes the term raw. We don't pull any punches, we tell it like it is.
I would say, this is what this patient said, we need it in the book, and everybody would gasp and say, can you say that? Can that be on paper? Can we really talk out loud about that? And it's like, absolutely. He said, it was then I realized I'm not bulletproof. And I always thought I was bulletproof. Men think they're immortal. It's not going to help that happen to them.
He drives himself to his doctor's office rather than calling 911 because he thought he was bulletproof right up to in the middle of his heart attack. But that's the issue. Men often are not going to make any life change until they've seen a buddy have a problem or till they're literally on their way to emergency room. And we'd like to get men to stop thinking that way.
A lot of my male patients ask me if it's too late, if they've done irreversible damage to their bodies. And I say absolutely not. You're the youngest you'll ever be right now, this moment. You can make changes and you can have a better life.
One of the reasons we wrote the book is so men would be happier. So this whole book is about making small changes in the way you eat, the way you exercise, the way you communicate, the way you relate to your children and your spouse, so that the end result is you get a huge return. This is like a return on investment.